been a physician for close to 40 years, and I've taken care of patients from birth and through their life, and have witnessed and supported patients during their dying process as well. Medical aid in dying is the concept of the process where a person who's been diagnosed with a terminal illness, expected to last, have a less than 6 months prognosis to live, is able to receive a prescription from a physician to administer to themselves, to self-administer when they feel is the right time, to be able to basically go to sleep, to die in their sleep peacefully and painlessly. My parents were both interned in many concentration camps, in Auschwitz and many others, and were finally liberated. And my mother had written several books about the topic. We talked about this constantly when I was growing up. And so there was a pervasive feeling of what horrors could happen with the dignity of life being eroded down in life and in death based on their experiences. When I first thought about the concept of medical aid in dying, I made this visceral connection emotional connection to my parents' horrible experiences, and jumped to conclusions that were not the same as what the concept of medical aid in dying entailed. And that is what led me initially to feel uncomfortable being able to personally support this if I was going to be involved. What changed my mind towards the concept of medical aid in dying was seeing many patients personally in their last stages of dying, in either home or nursing home or hospital, sometimes together with hospice workers or palliative care doctors at the same time, and seeing a significant number of them not having their pain relieved and their suffering relieved, and witnessing their pain. In addition, then seeing my parents' own deaths personally, and seeing the needless suffering that they went through despite their previous suffering, and feeling that this could have been avoided. I don't know what it's like for everybody or anyone. We only know from a person who's alive. We don't know. We don't have that opportunity. We can only intuit from seeing their facial expression, their movement, things that we use in our daily lives to interpret what other people are experiencing. And sometimes it's difficult at that point.